This conference will now be recorded.
So I'm going to start recording this conference. Yeah, so he is, and well-deserved vacation, I might say.
Well, he's doing it at the right time, I guess.
Exactly. So, yeah, so we'll just wait a minute more and see who all else joins, and then we'll get started.
How's the weather up there this week?
Oh my gosh, it's way better. It's so beautiful. Oops, I'm going to switch screens here. Let's see, and do monitor 1. Okay. In the webcam. Okay. Yeah, it's way better compared to last week. We had 2 days of where our office was closed, and then 2.5 days because of the weather was so bad.
Man, I know.
Yeah.
I've been doing a bunch of donation drives to Rosebud and Pine Ridge.
Oh, yeah.
And it's just we couldn't send anybody last week on Wednesday, Thursday, or Friday.
Yeah, I have some family that lives down in St. Francis in Rosebud, and they were stuck for like almost 5 days and couldn't get out. So, yeah, it was rough. I'm so thankful for spring. We are overdue.
Mm-hmm.
All right. Well, can you guys see my screen?
Yes.
Okay.
Yes.
And is it the one that has, can you see where it says slide 1 of 53, or is it just the whole slide?
Looks like the full slide.
Okay, that's what I needed. Okay, well, we're going to go ahead and get started. Am I at the beginning? It's been a long while since I've done a webinar, so bear with me, but I appreciate you all being on the call. I don't know if they typically do check-ins or who's on the line, so I'm recording it, so maybe if we can just go through, and it looks like I'm on. Again, my name is Tinka Duran. I'm the director of our Great Plains Preventions Program, under which the colorectal program is under. I have Brad Kruger from ASET on, and Jody Fetch is on from Custer Health. Nicole Lenore, I'm not sure where you're from. Lillian Tom Orm. I'm just going to say names. Lana Longbreak, Melinda Balderas, Nancy Valquez. I never can say your name, last name right. Sorry. Sandy Anderson, Shannon Bacon, Stacy Burnett. It looks like Storms Caleb, and I apologize if I am giving wrong names out, not saying them correctly. Is there anybody that I haven't mentioned that's on the call? All right. Well, it looks like people are still joining, so we're going to go ahead and get started. We do have a couple of presenters today. We're excited for that, but I want to go ahead and give you guys an update of the current happenings with the colorectal task force and with the program and what they're doing. So I will go ahead and advance the slides, and we'll get started. Before we get started, does anybody have any questions? Okay, great. So this is the core. I'm sorry, yes? Easy to say. Can everybody mute their lines, please? No. All right, so this is the quarterly Great Plains Colorectal Cancer Task Force quarterly task force call. April 17. I think I'm going to mute everybody but myself. Let's see if I can figure out how to do that here. Mute other people. All right, yeah, I have you all muted. So if you have a question, please wait till I unmute, which will be when we transition to our two presenters. Or if you would like, you can type it in the chat box. It sounds like we were already getting some feedback and background noise, so I went ahead and muted everybody. Okay, so next slide. So the agenda is we're going to talk about the Colorectal Cancer Awareness Month reflection. We're happy to have two guest speakers, Sandra Cruz Anderson from the Winnebago Tribe of Nebraska and Miss Jody Fetch from Custer Health up by the Standing Rock Sioux Tribe. And then we also will ask for some partner updates. So we all know that March was Colorectal Cancer Awareness Month. We had a photo contest, Show Your Blue GP, Show Your Blue Great Plains. We had a health board. Here at the health board, we had a colorectal cancer event. We worked on proclamations with the tribes, tribal support and proclamations. We also, the team was very busy going out, taking the rolling colon and other educational information out to different colorectal cancer awareness events. And then we had Dr. Gerardo Brooks do a presentation last month. So very busy. Oh, look at them. I did not make these slides. They did, so I apologize. But I like how they're fading in. Isn't that pretty? So we'll wait for that to finish. So the photo contest every year, again, March is recognized as Colorectal Cancer Awareness Month. Oh, it went without me. Go back. Sorry about that. Come on. Come on. Sorry. All right, there it is. I'm not sure what was going on there. So our team created a campaign to encourage tribal communities to raise awareness about colorectal cancer. One of the ways that we did that was a photo contest, and it had participants. Why is that sliding without me? That is so weird. So anyways, I will hurry before it goes on its own again. But taking group photos of themselves wearing blue or however they deem to support and show their support of colorectal cancer. We know blue is a color for colorectal cancer. As you can see, the blue ribbon at the bottom. Wow, that was fast. So let's take a look at the contestants. He must have this on slide. He does. Oh, dear. All right, I can stop that. So the first one, I just figured that out. It was on a timer. Oh. Not sure how to display settings. Hold on just a second. All right. Well, I guess I'm on a timer here, but I'm trying to figure out how to stop this from doing that. So we're going to go back because I don't like this thing telling me what to do. The first one was the Turtle Mountain Band of Chippewas. Chippewa, that is, it looks like they have the stool test there. The second one was the Ponca Tribe of Nebraska. It looks like, I believe that's the chairman there in the middle. That's exciting. The third one was McLaughlin IHS Service Unit. The fourth one was the Lower Brule IHS Service Unit. And the fifth one was Fort Yates IHS Service Unit. And Nebraska Urban Indian Medical Center. And ASET. ASET is our evaluation program or team for our Great Plains. I need to figure out how to make, if you guys are gonna have you hold on for just a second and figure out how to stop this from advancing. So just a second, please. So the contest winners, as you can see, were first place was the Turtle Mountain Band of Chippewa. Second place was the Ponca Tribe of Nebraska, and third place was Standing Rock. The first place team will receive a plaque and a canvas print of the photo, and second and third place will receive a canvas print of their photos. So please be on the lookout for that. I'm sure the team will be getting hold of all of the winners and be getting those prizes out to them. And I think I have stopped the slideshow from moving on without me. Here is our event that we had on March 29th. We did a colorectal cancer awareness. We set up the little colon. Actually, that looks like the big colon. And we did colorectal cancer education, and we also did a chili cook-off. And I think we have more information. This is a lot of our staff at the Tribal Chairman's Health Board that all dressed in blue to show support of cancer awareness, colorectal cancer awareness. So here is the chili cook-off that we had. We had 8 contestants enter, and we had over 30 judges that voted on it. Very exciting. So lots of chili for everybody. The winners were Les Kemp, if you look at to the left, and then Don Arkinson, and then our chili renowned people, Brenna and Chad, they tied for third place, so that's very exciting. Brenna, it was quite interesting, had a vegetarian chili, and that took third place, which is really good because sometimes vegetarian chili is not always, not everybody likes it. So, but it sounded like it was very good. I unfortunately wasn't here. I was out of the office, but it sounded like good times are had by all. So the other thing that we've continually done in the past is every year we try and work with tribes to increase proclamations of support and to get the tribal leaders, the tribal presidents, or the tribal chairs to sign a proclamation to proclaim March as Colorectal Cancer Awareness Month. This year they had 4 new tribes: Ponca, Santee, Spirit Lake, and Standing Rock. What we've tried to do, what we found out in the past was that the proclamations were made just for 1 year. So it was proclamation in support for 2018 or 2017. We decided that we would try and reach out to the tribes again and make them continual, so that it doesn't have just, so it's not specifically for 1 year, but it's a continual proclamation. And that way those proclamations can be used to gain awareness to the tribal communities. We know when tribal leadership supports something that, they are definitely trusted in the tribe, and the community trust what they're doing. So proclamations of support are great ways to gain trust and provide education to our tribal communities. We can use these, and you can use these by helping us by putting them in the papers, talking about them on the radio station, those types of things, even posting them if available. If it's okay to post them in the papers, definitely make sure that you check with your tribal person, that either the council or the chairman or president, to make sure that they're okay with you advertising it out. But again, it is a very worthwhile effort, and it does seem to, get a lot of people aware of Colorectal Cancer Awareness Month, and even tribal leadership, then they become aware.
I was going to take a picture of it, but I don't know if I could go back.
Oops, sounds like I hear somebody on the line. Not sure who that is.
I don't know if I could go back
sounds like
and
Lana
one, but
Longbreak.
we should go to that conference for sure, because we get
Hello?
presented.
I can
award.
hear somebody talking about a conference that they're planning on going to, and maybe you're talking about ours. I'm not
So
sure.
what you fill out
If you
that
mute
form.
yourself, please. I'm not sure who that is, but please make sure you're muted. Thank you. Lana Longbreak just put in the chat that Fort Thompson sent their tribal proclamation as well. That's awesome. Thank you, Lana. All right. So next screen. Here's the resolution from Ponca. And we have this, if you know, the whereases and the information that can be placed into a tribal resolution proclamation. So if you guys need the template, we can definitely send that to you. And it's never too late to get started on getting one and then being able to post it out next year. Here is Santee's and Spirit Lakes, Standing Rocks. If you look at Standing Rocks, you know, it says that they're going to proclaim March, every March, not just 2019. So that's important. I think it may say the same thing. Yeah, like this one in Spirit Lake, it will be proclaimed that the month of March will forever be proclaimed as Colorectal Cancer Awareness Month. So that's the important part that we really, if you're going to get a proclamation, is that you ensure that they make it continual. All right. So some of the educational events that our staff attended and assisted with education at was Winnebago, Turtle Mountain, Spirit Lake, Crow Creek, and Nebraska Urban. So they participated, like bringing out the rolling colon, setting up booths, maybe doing, I know they have colorectal bingo that they do. I know they've done some presentations as well. So all those types of educational information is available to you through our program. They're more than happy to come out, just need a couple weeks notice so we can get our travel in. But they are more than excited to come out and bring the colons with if you'd like. There's always plenty of different types of educational information that they can provide for you. From presentations to bingo to Who Wants to Be a Millionaire. And they're all specifically focused on colorectal cancer. So here's the Winnebago tribe, their event with Nolan the colon and Mr. Eugene Gallego. Looks like he was down there for that one. Here's Turtle Mountain with Chad and Eugene, and with the rolling colon there. Spirit Lake, and there's Devereaux and Chad. Sorry, it's Wednesday. And then also we had the honor of having Dr. Gerardo Brooks do his presentation on screening, improving colorectal cancer outcomes for American Indians and Alaskan Natives. There's a link to the presentation if you haven't seen it. It's a very good presentation. These slides will be sent out to everybody after today, and these links will be provided to you as well. So if you didn't get a chance to see his presentation, I encourage you to click on the link when you get a few minutes and watch his presentation. It's very informational. So now we're going to go ahead and start with Ms. Sandy Cruz Anderson. She's going to be our guest speaker today, and she is going from the Winnebago tribe of Nebraska. I believe she's the public health nurse, and I'll let her introduce herself a little more. Sandy, I am going to find you here and unmute you. Sandy,
Okay.
can you hear me?
Yep. Can you hear me?
I can. I can advance the slides for you if you like.
That'll be perfect.
Okay.
My name is Sandy Anderson. I have worked at Winnebago in the public health nursing department for 20-some years. And just in the last 3 years, I've become involved in the CRC screening initiative here at Winnebago through the Winnebago Public Health Department. It kind of had a rough start. I didn't know a whole lot about it, and I've learned lots about it with the help of the colorectal cancer team in Rapid City over the past 3 years. They've been extremely helpful in helping us decide what our goals were and helping us to achieve those. So they asked me to do a little presentation on kind of our transition of where we started and where we are now. Over the past 3 years. So go ahead and advance. Okay, this kind of gives a little bit about what our 3-year history is. You'll notice that our benchmark year was 2016. We actually used our GPRA rate as kind of our benchmark because we didn't really have anything else to benchmark against. So our benchmark in 2016 GPRA measure for colorectal cancer screening was 15.6, which is kind of dismal. Once we saw where that was, it kind of gave us an idea of where we needed to go. We were seeing wonderful work being done out of all of these different service units who were meeting their GPRA measure and more. And quite frankly, we were just a little bit jealous of that and kind of trying to figure out how we can do a better job here. You'll notice in 2017, that's after we initiated in our first year, we almost doubled our screening rates. And then just this last year, 2018 GPRA measure, we didn't go down, but we really didn't progress much either. We increased just slightly, almost made our GPRA measure, didn't quite meet that, but you know, there's always next year. So go ahead and advance that. So these are the things that we learned in the 3 years that we've been doing this. Our first year, we chose the interventions of patient reminder system and reduced structural barriers. Some of our strategies, really our major strategy, was just first of all identifying through using the EHR and iCare how to find people who were 50 and older who were our population. So we did that, and then the clinic sent out, and we also helped them, we sent out the colorectal cancer screening reminder cards that it needed to be done. We sent out flyers, we had social media, again, we used iCare, we used colorectal cancer articles in the local papers and the wonderful handouts that they supplied to us. We did have rolling colon at our health fair that May. I guess we just didn't really know a lot about the program, so we drove all the way to Lincoln and got it from the state. We didn't realize that you guys had it out there in Rapid City and drug it back to Winnebago and had it with our fair. So that was our first year. We used our money, the majority of it, in getting gas cards. And that year also, I think, Tinka, you might have been involved in this. We had the team from Rapid City that came and did a provider assessment for our medical staff on where we were at with our colorectal cancer screening, which again was dismal. That one assessment really did, and I should have put that in yellow too, because that really did do a lot in mobilizing our medical staff. In realizing how important colorectal cancer screening was. Unfortunately for us, our medical staff is kind of a rotating door here at that time, and the people that were there for the assessment were gone within months. So it was really kind of difficult to revitalize the new people coming in. You were always retraining medical staff and whoever came in. So that was kind of a bummer, but the actual provider assessment I would encourage everybody to take advantage of because it was it had a lot of good information. But really the greatest impact was the gas card. We were able to inspire people to come in at least and ask the question, just, you know, even if it was just for money. Our lessons learned that year, really, truly, and these are, I'm being totally honest when I put this on here, the CRC screening was not a priority in our medical community. And I think that was obvious with a GPRA of 15.6. Another thing is that the gas card incentive served as a catalyst. Whereas before we were depending on our medical community to order that test, once we started advertising and word of mouth and everything, our patients were basically driving the catalyst of this test because they wanted the money that they were getting for doing the test. So the patients were now asking the medical community for the test. Most people were not aware of the test. They didn't realize that they should be getting this test and that they should be doing it annually. So we really, in that first year, spent a lot of time educating our population that this test was something that was done annually and that they could have done at the hospital and take home with them to complete the test. Unfortunately, again, when we started, we were kind of in the dinosaur years too. I don't know how many of you are still using the Hemocult 3 card test procedure, but that wasn't really all that well received by patients. They didn't like it. It was cumbersome, it was icky, they didn't want to deal with it. So that's where we were the first year. You can go ahead and advance, Tinka.
Sorry about that.
That's okay. So the second year, 2017-18, again, we kept the same interventions. Our strategies really didn't change all that much, except for, we kind of got a handle on what to do and who to involve in it. So we really did involve the OPD staff, lab, and public health nursing. We used our media. Again, we started using social media, Facebook, webpage, flyers. We used the EHR patient navigation, of course, and we used a lot of community clinical linkages. I believe this was the year too, and I did not put it on here, but this was the year we started doing the flu fit. So we did do a few of the flu fit clinics too that fall. We used the postcard reminders, iCare again, trying to find our population. Articles again. One of the things that we found was highly accepted and made a huge impact was simply making testing bags and putting them in the clinic where the nurses were screening the patients. During the screening process, they identified right away they were 50 or older, or if it was time for them to have the test, or if they had the risk factors, they would turn around, grab a bag. It had everything in there. So that, I think, along with the gas card, probably had one of the, or two of the biggest impact on increasing our numbers that year. We did buy some educational posters for the exam rooms. We did community education, and we also had the rolling colon that was brought by the Rapid City staff at our health fair that year. Again, we did the gas card. This was kind of the year that was the beginning of our transition also. We realized that we did not increase our GPRA all that much, and that was a problem for us because we couldn't figure out how we were going to get people energized to do that 3-card system, and we knew that that was our biggest problem. So the lab director at that time did do a cost analysis for us of how much it would cost for us to transition to the one sample HemoSure test system. So she did that, she presented it, and as a result, we were able to do that the next year. Go ahead and advance. Lesson learned this year is that the CRC testing moved from being a patient-driven for the gas card to actually being more of a clinical-driven priority from the medical staff and nursing. So we still had people coming to ask for the test, of course, but our medical staff and the nursing staff were making that a priority. We provided the clinical staff with all the supplies at hand, and that actually increased the staff commitment and compliance. We engaged the OPD staff in problem solving and developing tracking methods that worked for themselves to increase follow-up, because that was kind of a problem for us too. So they did what they called a PDA, Plan, Do, Act, within their OPD clinic, and decided how the nurses were going to follow up on all the tests that they handed out. The gas card incentive was still used. It still increased the CRC screening, but it just kind of leveled off after our launch year. And we realized that we needed to make a change in our testing system from the 3-sample kit to the 1-sample kit so that it would appeal to more of the population. Go ahead and advance. Okay, this is just a little picture of what, we had purchased with the grant along with the gift cards. And you can see on the right-hand side, that was the bag that we had. It was an insulated grocery tote. And we would put 3 hats in there, the Hemocult test, the education that the nurse could give them, and we had a gift card and some other things. The little cup there thing is kind of a salad shaker. Kind of a funny thing is I actually had a patient that came back and asked me what we needed to do with that with the test. And when we told her that it was to put her salad in, she was like, oh my God, I was hoping it was something and we didn't have to put poop in it. So, that kind of told us right there we needed to do our education maybe a little better. Go ahead and advance. This is a picture of the rolling colon that year at our health fair and all of our stars right there that presented for us. Advance. And on our third year, 2018 and 19, we kept the same interventions again. Our strategies really were the same as what we did the year before. We still did the postcard reminders, the eye care sorting, the articles in the local papers. We still continued with the testing bags in the clinic, educational posters in the exam rooms, community education, flu fit, and in addition to that, we also did, in March, we had a patient awareness day / education day for staff because we transitioned into the HemoSure test kit. So on March 5th, go ahead and advance. So on March 5th, we had the staff from Rapid City that came, and we did a cancer screening month kickoff with our new testing system. That was on March 5th. We did like 3 clinical staff trainings that day with the help of the CRC screening or CRC people from Rapid City. Chad actually presented part of that with the history and all that. It really worked out very well. We had probably about 50 of our staff members that were educated that day. And then the next day we started with the HemoSure test. Again, the cost analysis by the lab director paid off. We went ahead and went to the HemoSure. One thing just to kind of let everybody know, if you are transitioning, even though once you make the decision, it doesn't happen overnight, it actually took us 6 months to initiate the new testing. We were hoping to initiate that with the new testing grant cycle, but you know what, it just did not happen like that. But we're happy to have it start in March. The GPCCSI staff, they're going to be bringing the large rolling colon on May 1st for us, and we'll have further community education. Go ahead and advance. So the impact of transitioning from a 3-test system to the HemoSure so far, we're still understanding the impact. There are things that we anticipated, and I'm sure there's going to be things that we did not. In March, I went ahead and did an evaluation. We did 24 HemoSure tests, and 9 of those were positive results. This prompted a review of the Hemocult ICT positive rates over the past year so that we could actually compare those against the new testing procedure. From what we could find after that year of doing a review, we had 190 Hemocult ICT tests that were performed, and 32% of 32 of those were positive, giving us a 17% positive rate. And even though, it looked like that was kind of, it was high here and there, some of the months we had like no positives, and some of the months we had like over half of the tests that were done were positive. So it just kind of ebbed and flowed as far as what our positive rates were going. We expected more positive results as a result of using the HemoSure because the sensitivity was so much better. But we're going to continue to monitor this closely to see what the impact is on the HemoSure, doing the HemoSure test. We already know that the impact is that we're testing more. So we need to actually just kind of, I guess, monitor, where the cost is going to be in the increase in colonoscopies as a result of positive Hemocult tests. So that's really where we're at. Go ahead and advance. If anybody's got any questions, feel free to ask or call me, email me, whatever, if you have questions on how we went about and did those things.
So, Sandy, I opened up all the lines, so if you have a question, we'll give you a minute here to go ahead and ask that. I've opened up everybody's lines, so you should be able to ask a question if you like, or if you'd like to type it in the chat box, you can do that as well. Okay, well, it doesn't sound like we have any questions at this moment. Again, if you have any questions, please type them in the chat box. After our next presenter gets started, I will mute lines again so we don't have any background noise. So Sandy, thank you so very much for
You're
presenting. This
welcome.
is very great information, and I'm glad to see that you guys have switched to the one card hemocults, or the 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 one that's more sensitive. I'm drawing the blank on the name of it, but the one card center. Yeah, HemoSure. Thank you. And we have seen across the board in the Great Plains that people, are more apt to complete a one stool sample versus a three stool sample. We see higher adherence and higher return rates, just as a general overview of what we've seen out in the community. So I hope that bears the same results for you guys as well.
One of the things I'll just add too is that there were people that I was begging to do this test over the past 2 years, and they refused to do it. When we switched to the HemoSure and I showed them what they needed to do with that one little test tube, oh, sure, I'll do that. And they did.
Nice.
Yeah, so it was really interesting. And also just to kind of let you know too, those that 17% that tested positive with the Hemocult test that we did the review on. I actually did a review too to see what the follow-up was and the result of it was. And the only thing I'm going to speak on really is that all of the ones that were positive that had a colonoscopy, completed a colonoscopy, every one of them had polyps or something that was of concern, and one of them had actually colorectal cancer.
Wow.
So the tests are not, for us anyway, that we are seeing a frivolous thing. They're really doing what they need to do.
Yeah, it definitely sounds like it. That's amazing. Okay, well, again, thank you, Sandy. I think we'll go ahead and move on. And Jody, are you there?
I am. Can you hear me?
I can hear you. You're a little soft.
Okay, I've never been told that before. I'm usually too loud.
Can everybody, I've got the lines open. Can everybody hear her okay? Does she need to speak up? We'll see. If I have problems hearing you, then I know they will. So I will speak on behalf of the group.
Okay, thanks, Tinka.
I'm going to go ahead and leave it open for now. If we start getting background noise, I'm going to mute all and just have you unmuted. So we'll go ahead and get started.
Okay, thanks for inviting me to speak today. I am Jody Fetch, the Director of Nursing from Custer Health, which is a public health agency that serves the Standing Rock Reservation. If you could advance the slide, Tinka. Oh, if you could advance again, please. All right, so our colorectal cancer screening, we use the FIT, the HemoSure iPhops also, and they are distributed by the providers at Indian Health Service. So when somebody comes in for an appointment, if they're due for colorectal cancer screening, they are given one of these kits. We do provide postage and self-addressed envelopes for easy return to the lab. So if they're not able to return them, themselves, they're not in close location, they can certainly send them through the mail. And then referrals are faxed to Custer Health. We get all the referrals for everybody that's received a FIT test. We are not in the same location. We're about 64 miles from Fort Yates and further from the other clinics. So those fax referrals come in and we track the stools then with a lot of help from Indian Health Service. We have some great partners that are able to help us. Every Monday morning I get a fax saying who's turned in their kits and if they're positive or negative. And then we do send out the results to the client, and we send an incentive. And the incentive is a $25 gas card, and those gas cards have worked for us too. If they haven't returned their kit, we do send reminders at 2 weeks and then again at 1 month we either use a mailing or a phone call to do the reminders. If you could please advance the slide. So this year, we've kind of had a slow start this year, and I don't know why. It just, we've been doing this since 2007 in multiple different ways. We've had, many systems changes over the years, but as of April 7th, we have distributed 120 fit kits and have 25 returned, with 6 of those kits being positive. So we're seeing the same thing as Sandy. We're seeing a lot of positive results. So I don't know why that is. I've checked with the company, and, they assure me that it's, it's blood either in the stool, the urine, it could be hemorrhoids, but we are seeing positives also. Next slide, please. We also have been working on patient navigation, as that navigation is really important. We had 34 clients that were in follow-up for positive FIT kits, and 14 have completed their colonoscopies, and 6 are in process of that follow-up. 9 have not responded at all. I did send a certified letter last week and have, received 1 call with that certified letter. And 5 have actually declined services, all. And I do send letters encouraging them. I send education, and really, really hope that they will change their minds. But we can only do so much, and hoping that, we will get everybody in for colonoscopies that need them. Next slide, please. Education is provided with each FIT kit dispersed, including instructions how to collect. Also, education is provided for those clients in follow-up. We have worked with the Great Plains Colorectal Cancer Initiative to get culturally appropriate education, which has helped. I think that's much better than sending them, education that isn't really, pertinent to them. So I think that has helped. Also, we have the Walk for Wellness, which is scheduled on April 24th in Fort Yates, and the Roll in Colon is coming. We have education including, colorectal, the Women's Way program, which is our North Dakota breast and cervical cancer early detection program, will be there. We have a men's health program, and also a lot of nutritional education, diabetes, multiple different booths that are going to be there. I think we have 15 booths this year. Last year, our Walk for Wellness, we had 254 participants. So it gets bigger every year. We invite students, just trying to get them acclimated to what colorectal cancer is and what the importance of screening. And hopefully they will take that home to their parents and grandparents. Next slide, please. So we have, a lot of successes. I always want to look at the successes in a really good way, because sometimes we do have challenges and they kind of block our positive with the successes. But, just getting fit kits returned, of course I would like more, but, to me that's a success, getting them returned. Clients successfully completing colonoscopy, that is huge. Just getting those people to navigate the system, because they not only have to travel, it's the prep, and a lot of our GI specialists like to do a split prep, which means you take part of the prep the night before and then part of the prep a couple hours before you actually have the screening. So traveling that distance of over 64 miles just to get to their appointment is a little difficult when there's no bathrooms in between. So it's very rural. So we're trying to figure out how we can make that better. And Standing Rock Tribal Health did receive a grant from the National Indian Health Board to help with transportation for that follow-up, and also for screening. If somebody can't get into the local clinics, they will pick the CHRs will pick them up with this grant and get them to the clinic. Another thing that this grant does provide is hotel rooms. So if somebody does have to do a prep the night before, they can stay in a hotel room, and that will be covered under the grant, which is wonderful. You know, a number of contacts for client follow-up. You know, we've looked at different models to see how many, you know, contacts we should have for follow-up. So what we've been doing is we've been meeting with Indian health service providers and quality assurance and CEOs and sitting down with those people on a quarterly basis and trying to figure out, you know, are we doing the right thing? Do we need to, you know, send more reminders? What should we do? And it was decided that the process that we should complete is 4 contacts for a positive stool, trying to get them into colonoscopy, and then followed by a certified letter. So that's what we have done. You know, I try to do a lot of calls because I think calls are more personal, but sometimes you just don't reach people. So I do send letters if I can't get a hold of them by phone. And also we have decided that we need a Fort Yates phone. So we are getting a cell phone that we can text people that will have an 854 number. We think that might be a little bit more helpful. So I'm picking that phone up after the walk on next Wednesday. Also, you know, really exciting, the Standing Rock crew, IHS, received an innovation award for the colorectal cancer screening collaboration through the American Cancer Society. So I did add a picture in the PowerPoint so you can see the picture with Governor Burgum that was taken at the Capitol. There is the picture right there. So this is our Standing Rock team with the American Cancer Society Innovation Award. So it's very much a team. We have to work together to move forward with the colorectal cancer screening, and I see our team getting stronger every year. All right, next slide, please. So challenges. You know, hard to contact clients. Sometimes phone numbers are disconnected. We find that, you know, we get mail returned, addresses are incorrect. We had a real struggle this year with our federal security clearance requirements through IHS. A lot of ups and downs with that and a lot of time spent, but we are all cleared and are able to be, you know, in the Indian Health Service system. And then we have RPMS, which is the Indian Health Service electronic record. We have that connected off-site, and sometimes that is challenging. I always, when I call Fred at Fort Yates, the IT person, he knows me very well, and he knows that I'm a nurse and I'm not very techy. So when he starts talking in tech terms, I'll go, okay, Fred, let me know. Is that the little button on the side, or what do I have to do? So he is wonderful to get me connected back on. So, you know, there's just a lot of things that we have that are good. Those little challenges, we keep working, patience and persistence to make sure that we're getting reminders sent and getting a hold of people for colonoscopy. Next slide, please. And this is just, if you have any questions, you know, and you can certainly ask them now, or if you want to call or email me, you certainly can do that also. You know, we have been working on colorectal cancer screening since 2007, and I have to say, you know, listening to Sandy, you guys have made great strides in the little amount of time that you have had. We started off actually with digital rectal exam specimens on a HemoCult card and have moved up to the HemoSure iFob. So, you know, I just think of all the trials, you know, as we've moved along, but I'm so glad we are where we are.
Great. Thank you, Jody. That was so informational, and it definitely sounds like you've made some very large strides from 2007 to currently. So if anybody has any questions, please feel free. Your lines are open. Please feel free to ask them. If we look in the chat box, I think everybody can see that. We have Shannon Bacon that says, congrats to your team, Jody. And also Sandy Anderson, wow, that's awesome. So is there any other questions or comments? Your line should be open. Oh, wait, let me see. Yeah. Your lines are open if you so choose. Would it be possible to get a copy of the slides, Shannon Bacon? Yes. These slides will be sent out. I will send them out to all here after the call. Thank you for that. That's a good question, Shannon.
Hi, this is Denise. Can you hear me?
Yep, we can hear you.
Oh, this is Denise from Standing Rock. I don't think Jody knew I was on this call today, but I listened to the presentation, and that's great. So I'm the quality person from Standing Rock, and Jody is 100% right. We started really basic in the beginning, not really being a focus, colorectal cancer at our facility to begin with in 2017. And with Jody and all the people we reached out to, it has definitely improved and grown and become a topic almost, like I said, weekly. Like every week we're talking, did someone send Jody the list so we can follow up on who we need to find? And so it has been a journey. There's still lots more room for improvement. And it's been great just having all these people come together to help us. So it's been wonderful.
Awesome. Thank you.
Yes, thanks, Denise. You are awesome.
A couple things in the chat box if people are not on and are just listening by phone. Great presentation. It looks like Melinda would like a copy of the resolution be sent out to review. Well done, everyone. Thank you for a very good presentation. Yes, I can send a copy out with the slides. Let me make a note of the draft proclamation that you can use in on your reservation. I will send that out as well as an attachment.
Hey, it's Nancy in Omaha. I just wanted to say congratulations to all the photo winners and on the 2 presentations. Congratulations. You guys did a great job.
Thank you.
Thank you.
Any other questions, comments on the presentations? Okay, well, we will, we've got a few minutes left, but I think we only have a couple more slides, so we'll go ahead and move forward. These slides will be sent out. There is some resources that are available. National Cancer Institute has a colorectal cancer screening, what to expect video that can be used to raise awareness. We know that many people are scared of, especially if it's a colonoscopy, and they may not understand exactly what a colonoscopy entails. This video can help you relay that information to them. Also, the American Cancer Society has the right test for the right patient at the right time. This was another one of Dr. Brooks's presentations, and so we have it on our website, but here is a link to it. Again, it will be sent out. These slides will be sent out after this presentation. And then finally, American Cancer Society has a risk assessment and screening toolkit that we can send out for you to look at as well. Announcements. Our Great Plains Partners in Cancer Screening Conference is coming up fast. It's May 22nd and 23rd here in Rapid City, South Dakota. At the Ramkota, we're very excited. We have some national speakers coming. Let's see. So we're very excited about that. We hope you all register and come down and listen to some of the national speakers that we have coming and local speakers as well. There are travel scholarships available still. The travel scholarships are on a first come, first served basis. So if you have not registered and have not applied for a scholarship and need one, I would advise to do that sooner than later because, again, when we reach a maximum amount of scholarships, and then we will close the scholarships. So please don't wait till the last minute to register and apply for a scholarship if you are interested.
Hey, Tinka, it's Nancy. I had a quick question.
Sure.
Is the conference ending at noon on the 23rd, or are we doing a full day?
We're closing at either noon. We're still trying to figure out, we're waiting for one. We may have a lunch presentation, so we may end a little later. The latest we would go is 2 o'clock.
Okay.
So we're still trying to decide if if the organization wants to do a lunch presentation or not. We should know shortly and be able to send a draft agenda out probably next week sometime. Yeah, so it will end either by noon or 2 o'clock. Does that help?
Yes, I just needed to know, like traveling back to Omaha. So.
Sure. Yep. Any other questions on the conference? All right.
Well, I'm excited for it.
Oh, I can't wait to see everybody.
I always enjoy coming up there for it.
Yeah, it's a good time of the year, and it's kind of right before tourism, the big tourism season starts. So, if you can plan around, and we know some people bring family and they stay an extra couple of days and do the touristy things, many touristy things that we have here in the Black Hills. Again, it's a beautiful time of the year. Everything's greening up, and there's plenty to do here in the evening, so we look forward to seeing everybody.
Always makes for some good thunderstorms, too, when we're up there.
It does, most definitely. So the next thing we have is partner updates, announcements. This is an open forum for anybody that's on the call that would like to provide any partner updates, any of the states, tribes, our evaluation programs, any of the organizations that have any updates they would like to share. Your lines are open. You can share them now, or you can type in the chat box if you would like to as well.
Hey, Tinka, can you hear me?
I can. Is this
Okay.
Shannon?
This is. I have a little bit of an echo, but hopefully you can hear me okay.
Mm-hmm.
Our North Dakota Colorectal Cancer Roundtable meeting will be October 30th. It'll be in Grand Forks this year. We're excited. Dr. Wender is coming in from the American Cancer Society National Office, and he just brings a lot of enthusiasm. If you've ever seen him speak before, he usually ends up singing a little song or doing something that gets everybody excited. And so he's going to help us launch the 80% in every community campaign. And I'm really excited about the focus because it's really looking at the fact that not all communities are benefiting equally from screening. And so he's going to kind of introduce that and then help us think as a state about what that means in North Dakota and how we can develop some strategies around that.
That's very exciting, Shannon. I've heard great things about him. I don't think I've ever seen him, so we hope to make it up there.
Yeah, you'll have to come.
Most definitely.
Thanks, Tinka.
Yep. Anybody else? Okay, well, we thank you for your time today. Everybody have a great day. It is springtime, so enjoy the weather. I hope it's nice where you are. And again, we hope to see everybody soon coming in May. We hope you can come to our conference. And if you have any other questions or concerns, please feel free to reach out to me or the other staff here at the Health Board. So have a great day, and we'll talk with you soon. Thank you.
Thanks, Tinka. Have a good one.
You too. Bye-bye.
Thank you, everybody. Hmm.